My guest is Val DeFord. I am Chuck Gallagher. We have been having a discussion about men's health, especially prostate health. And as a prostate cancer survivor, one of the things we have been talking about were the various forms of treatment. When my doc said, yeah, prostate cancer, he said there are 4 forms of treatment. Of course, the first thing out of his mouth was surgery as the gold standard. And since that point in time, and that was back in 2005, there were 3 primary forms of surgery that could take place. So let's talk a little bit about the surgical options and maybe explain in a bit more detail. You're the nurse, but we'll call it nurse plus layman's terms,
Okay.
what the forms of surgery might be and what the differences are.
Okay. Well, I know that your doctor talked to you about prostatectomy.
Right.
So we know that that just means anything that's an ectomy means you take it off. So you get the open radical prostatectomy where you're cutting typically in the lower abdomen, and then you're going in and removing the entire prostate. As you said before, trying to spare the nerves as much as possible. There are a couple different approaches to take it, whether you go through the lower abdomen or you go below closer to the rectum. But that's about your size and the doctor's skill and what he likes.
And functionally, that practically means the doctor is making the incision and using his physical hands to go in, to feel the prostate, to remove it, to use his skill as a surgeon. But it's a substantive incision.
Yeah.
And something that probably means you have a little longer recovery time.
Significantly longer.
Right.
Significantly longer, because anytime you're doing an open incision, we'll call it, versus laparoscopic. So open is you're cutting open so that you can visualize and you can get in to see, versus laparoscopic where you're going to use a tube, usually as small as or smaller than my finger, to go in, and you're using cameras to see what's going on.
Okay, now you mentioned the laparoscopic, and as I understand it, I'm not a doctor, so we'll be clear, is, okay, so you have the laparoscope, which is, the, as you say, the thing about the size of your finger, perhaps smaller, that has a camera, but you're still using your fingers to maneuver. You're just able to go in with substantially smaller incisions and less tissue damage to be able to make that maneuver.
That's absolutely correct. And using the laparoscope, typically there's going to be a camera where you can see exactly where you are inside as compared to, and there's magnification on that camera as compared to this is my eye looking at it. So it gives you an enhanced ability to get to the very specific spot.
Right.
And then there's the robot.
So when I was diagnosed, my surgeon was accustomed to doing just radical prostatectomies. And I, of course, decided I was going to explore what are the options. And when I went to the Johns Hopkins website, they were touting the use of the Da Vinci robotic surgical machine. And it's an amazing looking gizmo. It looked like a big mechanical spider.
Yeah.
It's odd. In any event, after making a trip up there and talking with them, 2 things occurred to me related to the robotic surgical option. It's laparoscopic. There are 3 fairly insubstantial incisions, less than an inch, in your lower gut area is the best way I would describe it. And literally the surgeon is sitting over at a series of TV screens on the other side of the room with like joysticks, and he's sitting there, doing this surgery, and it's like, that's amazing.
It is. The beauty of it is, of course, the robot helps the doctor. There is a really great camera. The robotic manipulation is an even smaller device than what would have been done. And so as we get more and more into artificial intelligence and the ability to help those machines help us, those surgeries are even more intricate. They typically, because of the skill level of the person operating them, mean that you're going to have even fewer potential side effects.
Now, you know me pretty well, and I have a bit of an odd sense of humor. So at the time, there weren't many of those machines in the country. So my first question to the doctor was, how many surgeries using the machine have you done? And when he said 600, I thought, better.
Pretty good.
Then I looked at the doctor. He was a fairly young fella. And I asked him, are you good at PlayStation and Xbox? Because I'm sitting there thinking, you know, my kids are really good at that finger manipulation, you know, playing games on TV.
Yeah.
I suck. I just don't have the dexterity. So it struck me that if you're going to be using the robotic machine and you're sitting over there with little joysticks and so forth watching these video screens, I hope you are really good at playing these games and you have finger dexterity to understand what you're doing.
Oh yeah, well they have been in simulation so long before they ever get close to a human that you really don't have to worry about that. Those computers are amazing. After having worked at several academic medical centers and sitting in the theater and watching it happen, it's glorious actually, and it's such a great thing for all of us.
I'll never forget, Valda, you know, when you're going into surgery, you know, they give you the medication, count back from 100, whatever, you know, you're going off into bliss someplace. But I'll never forget, I was counting back and I'm going into the operating room and I look up and I see this just massive, I thought, what a mess. I didn't think it was supposed to be this messy. And of course, next thing I know, I'm out. And in my case, 7 hours later, I come out and the surgery was absolutely fine. And I am, again, I've said this before, deeply appreciative that the surgeon was more concerned about my outcome than the number of surgeries that could have been done that day.
Right.
And that to me is one of the things that you probably want to look for in your surgeon, is to make sure that if yours is not the simple 2-hour case, that it's okay. They will take their time because the outcome is more important. Absolutely.
And having worked in hospitals for many years, I know that we have a plan for what's going to happen that day. We think, okay, we'll have 4 surgeries today. Then we end up with 1, or we end up with 6. That's just the way it is. And unfortunately, there might be someone who didn't get their surgery that day, but it's also better for him to know that the surgeon who did not do his surgery that day is one who was taking better care of the person who came before.
Absolutely. The one thing I'll say, and I want to be cautious with this statement, I think anybody who has had a successful outcome tends to believe, well, that's the best.
Yeah.
So I had the robotic surgery. It was a successful outcome. However, now lots of places have been able to afford the robotic surgery machine for prostatectomies and other treatments.
Sure.
But I would always encourage, make sure the doctor you have is someone that has really, is seasoned.
Of course.
As we do this video, now this will date it a bit, but as we do this video, there's a big controversy about Boeing aircraft. And there was a news article today talking about the difference between how U.S. pilots are trained in the simulators they use and folks in other countries that don't have access to the simulators and have to learn in different ways. And so I use that example to say not all doctors are trained exactly the same.
True.
And not all have the same experience. Someone that has used the machine 200 times has skill, no question. But probably someone that's used it 2,000 times has a bit more skill or maybe a bit more finesse.
Well,
at least we would hope.
Absolutely. Even if I'm going to get my nails done, I like the person who has not just started yesterday and who has been doing this for a few years and is the preferred manicurist at the salon.
There we go.
Yeah.
So, Valda, you and I have been talking about men's health. We're going to continue. Now, we've talked a bit about going through what the options are. Now we probably need to focus on, so what happens following?
Absolutely.
My guest is Valda Ford. I am Chuck Gallagher. We're talking about men's health, especially prostate health, and hopefully by the time you finish this entire series, any question you've had, we likely will answer, or at least come close to. And Valda, one of the things that's true is if you want more information medically about the types of treatments and so forth, visit valdaford.com. Look for her blog, where she'll be talking in much more depth about some of these and providing incredible links that you might want to go to when you're doing your research considering issues that relate to men's health and prostate health.